Good day, my viewers. Today we talk about febrile convulsion in a child. What we mean by a febrile convulsion is just a seizure that happens when the child's body temperature rises quickly, usually from a fever. It mostly occurs in children between 6 months and 5 years old and is surprisingly common. About 1 in every 30 children will experience it at least once. The convulsion usually starts for a few seconds and lasts to about 2 to 3 minutes. And in this case, the child may experience loss of consciousness. They may have a jerky movement in the arms and legs, roll their eyes back, foam slightly at the mouth, or sometimes they just go unresponsive. Then suddenly they recover, looking tired and sleepy afterward. So why do fever cause seizures in some kids and not in others? As we all know that children's brains are still developing, their nerve cells are more excitable. When the body temperature spikes quickly, it triggers an abnormal burst of electrical activities in the brain, leading to seizure. It is not because of how high the fever is, but it is how fast it rises. And common triggers include viral infections like flus, measles, ear infections, or anything that can cause fever. Also, they can experience it after immunization within 1 or 2 days after immunization due to mild fever. And sometimes no cause is detected at all. And also, there's a mild genetic tendency, which means that if one sibling had it, others may be more prone to it. So, what should you do during a febrile convulsion? When it happens, the key word here is to stay calm. I know it is easier said than done, but panicking won't help the child. So I will highlight 5 steps on what you should do. Firstly, lay the child on their side on a flat surface. Let the floor, like the floor or bed, to keep the airway open. That is, the child should lie on the side. Then secondly, remove tight clothing from the neck. Anything that can constrict the airways, let's remove it. Thirdly, do not put anything in the mouth. No spoon, no water, no medicine, because they won't be able to swallow it. Fourth, time the seizure. Most last less than 5 minutes. Then the fifth, once it stops, let the child rest and cool naturally. You can step sponge the child with lukewarm water, not cold water, please. Afterwards, take the child to the nearest health center for medical evaluation. Then there are some instances where the parent or a mother should be worried. As I said earlier on, febrile convulsions are usually harmless. Some warning signs mean that you need to seek urgent help, like when the seizure lasts more than 5 minutes. Secondly, when the child doesn't regain consciousness afterwards. Thirdly, repeated seizure within 24 hours. Next, seizure happening without fever. And lastly, when there is weakness or paralysis after episode of seizure. In these cases, doctors will check for serious infections, which may include meningitis or encephalitis. These are infections of the brain and the brain coverings. Treatment and prevention. The good news here is most children outgrow febrile seizures by age of 5. There is no need for daily medications. But in order to reduce risk, you treat fever early with paracetamol or ibuprofen. Make sure you know the actual dose based on the age of your child. Keep the child well hydrated. Avoid overdressing during illness. Ensure good follow up after any seizure. If a seizure lasts too long, emergency doctors may use other medications, but these are to be done in hospital settings. Medications like diazepam or midazolam. So, to every parent out there, a seizure during fever can look terrifying, but in most cases, your child will be perfectly fine. The most important thing is to stay calm, keep them safe, get them checked after the episode, and that's all. So if you find this video helpful, please hit the like button, subscribe, and share to all parents out there, because every parent deserves to know what to do in that moment of panic. I'm still your Dr. Next Door, helping you to stay informed, calm, and confident when caring for your little ones. See you in my next video. Thank you.
Did you know what that paper tape is?
The one you did, the one you bought.
The one I bought.
I'm coming. Subscribe to my page, like, and comment. Thank you.